Definitely have had a very active life. Thought I was indestructible almost, and that surgical site infection really knocked me off that pedestal. My name is James Bane, and I live in Running Springs, California. Was in the Marines for 8 years, 2 combat tours. I survived several roadside bombs. I had to have a discectomy between my L5 and S1 vertebrae. The disc had ruptured and was crushing my sacral nerve, which caused my saddle to be numb and my right leg to be numb. They did the surgery. I was recovering right away. About 5 days later, though, I noticed that the surgical site was getting infected, a little redness. Trying to be a big tough guy, I was just like, oh, it'll be okay till I go to my follow-up appointment, which was a couple days later. But that night, I went into septic shock. I'd never felt that kind of pain before. And I ended up spending about 2 weeks back in the hospital. Was sedated for a couple days. The septic shock and the spinal meningitis was the scariest thing I've ever been through. Scarier than being shot at, scarier than, a motorcycle wreck. It was terrifying. There was nothing I could do but lay there and be in agony and hope the antibiotics worked. After the infection, now the scar tissue left behind from when they reopened me up is pressing against my nerves like the disc was. So it's still a pain that I have to carry with me. I've been so fortunate to be around so many former military guys who have lost legs or, have some kind of paralysis. And I've seen these guys do marathons and triathlons and, climb mountains and stuff. So it's inspiring. It allowed me to grow as a person. You learn how to adapt and overcome. That's a part of the Marine Corps, I guess, that sticks with me. Always been kind of a gym rat, lifting weights, and now I have to love yoga and cardio. So you might not be able to control your situation or your circumstances, but you can control how you respond to them. It's not the end, we overcome. That's what we do. In the military, we learned that an ounce of preparation saves a pound of pain, and it's true. Without the right tools, without the right training, you're not going to be ready for anything. And that's the key for a successful mission, and it's the key for a favorable outcome. I would challenge all medical professionals to continue to learn and train, to implement the best technologies that are out there, the best training that's out there, because your patients are counting on you, and you have their lives in your hands. We always said that complacency kills. And in your profession, it quite literally can. 0 starts with 1.